let's get started because we do have 7 attendees. If you guys go to the chat view, you can see that the panelists, there are 9 of us and 7 attendees currently. People join throughout. So we'll kind of start. I kind of want to do an introduction of each of the alumni. My goal is to kind of keep it brief, 3 to 5 minutes, no more than that. Tell me the year you graduated, where you're at currently, and kind of how you feel about Lakeland, how it has prepared you. We'll get into the questions that I kind of had sent earlier. We'll kind of keep it as an open conversation. Obviously, attendees, you can already see that we're very much about badgering each other and having fun. So the alumni still can
Kevin, you okay? You look dead.
Yeah, I'm trying to figure out how to adequately look at this screen, and it's just not working for me. I feel like an old man, like I can't figure it out here all of a sudden.
Don't call Becca. She'll know what to do.
She's wrangling the children right now.
Well, smart move. Anything you need to get away from the kids, that's what I'm doing right now.
All right.
Brad, to say hi. You do look respectable, extremely respectable. Are you the mayor of Chicago yet?
No, that'd be Lori.
Lori? Hey, Graf, if you were running for president, I'd vote for you right now.
You would not.
Trigger we're talking about. Oh, I would be all over what you have selling.
No politics. I already told you I disrespected you earlier today by prior choices. So that's okay. All right, let's get started. Ladies first, Dr. Clark. So tell us a little bit about yourself and your current role and where you're currently practicing.
Sounds good. I graduated a little over 2 years ago, and I am currently practicing in Greenville, South Carolina, at Prisma Health, which is a health system where we have 7 hospitals that I'm a part of, and then we're part of an even larger group, about 15 hospitals. So here I work at a level 1 trauma center, and then we also work at community hospitals. And I actually just joined our GME faculty here because I was so well trained at Lakeland. And what else do you want to know?
Sorry. Clearly I'm muted. I didn't realize that. What else do I want to know? Well, Dr. Clark, that's a good start. Why don't we move to the next and we'll address further questions as we go. All right. Dr. Graf, why don't you tell us about where you're at currently and when you graduated from Lakeland?
Hey everyone, I'm Nick Graf. I graduated in 2017, so 3 years ago. I'm currently in Chicago, Illinois at West Suburban Medical Center. I work for LTN and EPMG and also contracted at Gottlieb, which is part of the Loyola system. West Sub is it's a rough inner city hospital. It is a community-based hospital that I was also very well prepared to take on. I know Mick and Trigger were nervous for me starting out there, but we can get into why I was so well prepared to do my residency at Lakeland.
Perfect. Thanks, Dr. Graf. Let's go to Dr. Doherty. Let's see if he's figured out how to use this thing yet.
I know, I'm such an old man. So I'm Kevin Doherty, graduated in 2018 from Lakeland, currently up in Green Bay, Wisconsin at 2 hospitals there. Work for Infinity, which is part of Envision. I, as of September 1st, am the assistant medical director at one of our facilities and the trauma director at the other one. I also do stadium physician coverage for Lambeau Field for the Packer games. So it's kind of a fun little perk to my job.
Oh.
Obviously, Dr. Mancini doesn't like the Packers. He's a Bears fan. And it's kind of funny. So just speaking of his coverage of the Green Bay Packers at the sports medicine meeting for ACEP last year, I met one of Dr. Doherty's colleagues. So he had spoken very highly of Dr. Doherty regarding his coverage of the Green Bay Packers. So as an EM doc, just realize you have plenty of options once you're done with your training. And one of the things, if you live near a NFL facility, you could serve as an airway doc. So Dr. Doherty's doing a hell of a job up at Lambeau Field. All right, who's next? Let's go with Dr. Akramovich.
Yeah. So I'm Eric. I graduated in 2016. I stuck around at Lakeland for a few years and then made my way down to Michigan City, Indiana, where I'm the medical director of the ERs There's 3 of them down there now, Michigan City, Chesterton, and in LaPorte. And Lakeland did an awesome job of just preparing us as well as all of their graduates. I'm interviewing multiple people to come down to work, and I have no concerns that they would not be able to handle a busy kind of inner city population mixed in with a population of upper and middle class patients that are other facilities as well. So it's a nice, well-rounded education that it can definitely handle.
Perfect. Thank you, Dr. Akramovich. Now let's move on to lastly, but definitely not least ever in my mind, Dr. Spiewak. Tell us about yourself, buddy.
My name is Alex. I graduated in 2019, and then I went on to do sports medicine fellowship at Western Michigan University in Kalamazoo. So I finished that in July, and I just moved out to Tucson, Arizona. I'm with the Northwest Medical Center. It's a hospital-based employment where I work at 2 kind of main hospitals and then 2 smaller freestanding ERs. Kind of similar to the Lakeland system, and that it's a community system. I feel really well prepared to work here. It's kind of eerily similar. The hospitals are pretty similar in size between St. Joe, Niles, and Waterville being sort of like a freestanding, and kind of just jumped in running to all those places and feel pretty comfortable working at all those.
Thanks, Dr. Spiewak. Now I'm going to jump to kind of talk to Dr. Graf and Dr. Akramovich. As well, I guess kind of all of you are in some sort of admin role at this point in time. But tell me about some of the applicants that you're looking at as they interview for your current sites, and what are you looking for, and why do you feel that a community-based program such as Spectrum Health Lakeland sets us apart from the level 1 trauma trained docs? I know Dr. Graf has a lot of opinions on that, and I'm sure Dr. Akramovich, as I spoke with him recently about it, can tell a little bit about this. And I'm sorry, Dr. Longobardi, we will get to you. One of our chief residents is on as well. I haven't forgot you, buddy.
Hey, who's got that dog?
Don't worry about it. I'm in my backyard. I'll mute it again, all right? Just don't worry about it, Nick.
You're
Right.
the dog.
We just go ahead, Eric.
Yeah. So I'm sure Nick will agree. It's great to have a nice, diverse ability to care for all types of patients, and that's something that a community medicine program does. I've run into some of my colleagues that I currently work with that trained at level 1 trauma centers that had never seen shingles before, that had never seen simple things like bed bugs and scabies, and that's a big part of what emergency medicine is, on top of managing traumas and doing things on their own. It makes a big difference when you are well-rounded and you're able to see all types of patients from all ages, not just 1 month out of the 3-year residency in a pediatric ER. I need someone that can really manage the room, manage the department, and understand flow, and understand how to take care for all types of patients. And that's exactly what you learn in a community-based program. I'm sure Nick Graf would probably also agree, coming from where we are to an inner city population as well.
Definitely. I echo everything Eric's saying, and I think something that sets Lakeland apart from other community-based programs, because you're going to get a great education no matter where you go, right? But what sets Lakeland apart, since it still is a trauma 2, I believe, and center, but it does not have surgical residence, and it's a trauma 3 now. Okay. Well, you're not going to have the same thing you're going to have at like a trauma 1 center, where you, of course, are going to have a great education, but what's going to take over from you and not learning how to run the full room. So you're going to have surgical residents, anesthesia residents, all the subspecialties, which is awesome in theory, but most places you're going to train, unless you stay in that type of institution, or you want to stay in academia at a university setting, you're not going to have every single subspecialty to refer to. So what Eric and I are both looking for when we're hiring people and bringing people in to be comfortable in our setting, a very busy inner city population that is not a trauma center, such as I work at, where we have multiple gunshot wounds daily, is someone who knows how to do all these procedures, that doesn't have to rely on having a subspecialist there, and how to run the room efficiently with just single coverage overnight even. And that's what Lakeland taught us. Since we didn't have to battle, per se, with other subspecialties to learn all the procedures, we easily picked up on how to do all that, how to do simple things such as putting on splints on our own. We don't have to rely on a technician or an orthopedist there to help out with that. Because you're going to end up in your career at many different institutions, and you're not going to have all the resources you may have had in residency or at certain, university settings or trauma one centers. And that's what we got at Lakeland. We had a well-resourced hospital where we learned how to do everything on our own as ER physicians above and beyond, where we could take it to where we're going to end up, such as inner city Chicago, South Bend, Indiana, Spectrum doing sports medicine. It's all very, very different situations, but given the opportunity at Lakeland to learn these on our own and be very well-rounded as residents sets you up to be a well-rounded emergency physician in the end.
Perfect. Thanks, Dr. Graff and Dr. Akramovich. Dr. Longobardi, we'll bring you in real quick, and we're going to answer your question, Kai. We'll get to that with Dr. Spivak next. But Dr. Longobardi, why don't you tell us about the current trauma situation within our hospital and how we manage our traumas as we are level 3. Designation doesn't mean much from a standpoint of what's done in the emergency department, which everyone has to understand. It's more who is available from a call standpoint. So Dr. Longobardi, why don't you chime in and let everyone know how we manage our traumas in the ED.
Yeah, so it looks quite a bit different than a level 1 trauma center. When a trauma rolls through the door, you're in charge of the room, you get to run the whole room. So I can use an example I had recently where we had a head trauma. That patient needed an airway right away. I was able to teach one of our interns how to do the airway, then move on, do the entire primary survey. It was 20 to 30 minutes prior to the trauma surgeon getting there. So that room was completely mine until that trauma surgeon got there. And even then, it was a very cordial relationship once he got there to help manage this patient. And we were mostly making all the calls. It's quite a bit different. We get the experience at a level 1 trauma center when we go up to Spectrum in Grand Rapids, and we get the opportunity to run a trauma team or be a part of a trauma team at the level 1 center. And so you get a little bit of an experience of both, but you don't get that sense when you're at that level 1 trauma center that this is your room completely and you get to run everything in it.
Perfect. Thanks, Dr. Longobardi. Level 3, as I said, is based upon kind of more so what resources you have at your fingertips, not so much what comes through the door. So we had a pretty busy summer with penetrating trauma this year, which we tend to see a couple a month, but it felt like we were seeing pretty much what the numbers came down to. We were seeing 3 or 4 a week, which is unlike what we've had in the past, because we were seeing, like I said, 1 or 2 a month, and now it's 3 to 4 a week. So we're getting pretty busy, and we're close to a major highway, so we see a lot of blunt trauma. So let me answer this question from Kai. Kai asked, I'm interested in sports medicine. I'm glad some alumni are involved in sports medicine. Can you talk about how residents can be involved in sports events during the training? So Dr. Spivak, since you were a recent graduate of the sports medicine track, and we currently have a second year in our sports medicine track, let's get into that a little bit and answer Kai's question.
Yeah, so there's actually a ton of opportunities at Lakeland, whether you want to ultimately do sports medicine fellowship or not. Just as sort of being well-rounded EM physician, you can get involved with those kind of sporting events. There's the sports track, which is a specific sort of way of setting yourself up to apply for a sports fellowship and kind of hitting those milestones that they're looking for when you're interviewing for sports fellowship. But some of the opportunities that you would have would be working with Dr. Trigger, likely in his clinic. He runs a sports clinic, concussion clinic, as well as covering high school level football, varsity football. And then there's you do some training room coverage with that, which is good experience because you get a lot of time to spend with the athletes, and Dr. Trigger kind of lets you do your thing. You also get to do pre-participation physicals. Previously, COVID has kind of thrown things upside down in the sports world in general, but pre-participation physicals are a pretty big deal for sports medicine. So you get a chance to both do them and sort of run the show for doing these mass participation PPEs. You also get to cover some large events. One of them in the past has been the Steelhead Half Ironman, which is a really fun event regardless of if you want to do sports med or not. It's just fun to get out there and do some coverage for that because there's a lot of athletes. You know, these events have 2,000 to 4,000 athletes. Some years it's been really hot, so we've seen some good pathology from that, seeing hyperthermic athletes and all the kind of stuff that you see in a mass participation event. There's also the senior PGA that comes through every 2 years. And again, COVID has kind of thrown a wrench for all sporting activities from professional to high school and collegiate levels. So that's all kind of up in the air this year, but there's a lot of opportunity to do sports and event coverage. And it definitely allowed me to be successful to match into fellowship.
Thanks, Dr. Spivak. I appreciate that. Yeah, so I try to get residents involved in all events. Currently, this past weekend, I'm not sure if Dr. Spivak mentioned Redbud. Redbud's a big motocross event. Redbud. Yeah, exactly. So it was a 4-day event this weekend. We had at least 3 to 4 residents out there every day, working with Dr. Beyer, and Dr. Beyer even readily admitted to me the other day that it was more of a sports medicine event because they didn't have to deal with the spectators as much as they normally do. So we're going to transition. One more question. I know we have a few questions here along the side, but I want to ask Dr. Clark, how do you feel Spectrum Health Lakeland prepared you for a role in academics in your new position?
Yeah, so very new to GME, but I feel like Lakeland had all of the opportunities that you could want to get involved with lectures and didactics. They were more than happy to guide you along the path of teaching others. Of course, there are medical students that we'll have rotating through, and that is always very helpful to learn how to teach. So not only be taught, but teach others that are either lower than you in, so like your interns are below you in residency, or medical students who are rotating through. I think that had a large part in preparing me for being at a teaching institute where I also have residents and medical students. I was able to step in day one and have residents that I'm working with. And I feel very well prepared for that, very well prepared for working with others and working a part of the GME team. You have a lot of flexibility. As much as you are willing to give into a program, you're going to get out of it. And so teaching opportunities wise, yeah, you have whatever you want. You can get involved with podcasts. You can get involved in like extracurricular activities, like doing the sporting events. You can get more involved with ultrasound. All of those, I was ready and well prepared when I arrived.
Perfect. Thanks, Dr. Clark. Yeah, so Dr. Clark's right. Dr. McCarthy, who's behind the scenes here tonight, is doing our medical education track. So we're preparing our residents well to proceed into academics. Several of our residents have pursued academics and are currently in core faculty positions. Dr. Whitworth's our current simulation director, and she stayed on here. She'll be joining us in future podcasts and Zoom meetings. So let's get to a couple of the questions. We'll go to Dr. Doherty. I don't mean to leave anyone out, so please chime in. I think there's a raise your hand button. If not, we're all very well adept to interrupting people. But Dr. Doherty, let's talk about your pediatric experience. Someone's interested, Julie's interested in a fellowship in pediatrics, emergency medicine after residency. And her question is, does your program have lots of pediatric experience in the EM curriculum, or are there any alumni that have pursued this fellowship? I'll answer about the alumni. We don't have any alumni that have currently pursued a pediatric fellowship in emergency medicine, but Dr. Doherty is going to tell us about the wonderful pediatric experience we have here at Spectrum Health Lakeland. And I will add, we have started a pediatric emergency medicine track with one of our pediatric hospitalists here just recently, and we'll be enrolling, or one of the residents will be starting very soon. So Dr. Doherty, on to you, buddy.
Cool. Yeah, the track sounds really cool. That was not something that was available when I was around, but we do see quite a bit of peds at Lakeland, and the reason for that is we're the catchment hospital for the whole area. So there's not a peds hospital that's siphoning off the sick patients. So you're going to see everything from the kids with a fever to the really sickest of the patients with the congenital heart diseases, because we're the local hospital, and that's where they're coming to. So there's also a great rotation up in Grand Rapids, which is the PICU rotation. While you're doing PICU rotation, you're seeing the kind of the next level up of the congenital heart diseases and kind of the ICU level care of the peds. So I feel very well prepared. I mean, I take care of lots of peds cases at my hospital. We're actually we have a children's center in my ER. We're the children's hospital in the area, so all the other hospitals send us all their kids. So I haven't ever felt like I was not well prepared to take care of the kids that are sent to us. So the peds experience is great, and I think it's probably better to have it kind of interspersed in your training, as opposed to some places that you go where you do just a peds month, here and there. Somebody will have to give me the numbers, but I believe the peds case volume at Lakeland was somewhere around 12 to 18%, I believe.
20. 20%. Yep.
There you go. Yeah.
Yeah, it was.
So can I chime in real quick, Chris, on that one?
Oh, please do, Dr. Mancini. Don't yell at us, though.
The PEDS question is always a great question. So we're seeing about 19 or 20% PEDS. Unfortunately for our population, we have the second highest per capita in the state of neonatal deaths. And that has something to do with some of our social economic class in a certain amount of areas too. A lot of ERs have split their emergency departments in the past into an adult and to a pediatric, but that's really changing as the finances with the institution really have pushed everything into one arena. And if you can imagine that being the case, is most emergency departments right now, if you're staffed fully with board certified emergency doctors, they have to be well versed and trained on pediatrics, which is really kind of diminishing the roles a little bit of pediatric specific EDs. So again, that's why it's very, very important that with any training that you do is you make sure you have a big peds volume so you feel very comfortable seeing peds and adults all at the same time.
Go ahead, Dr. Spivak. We saw you raise your hand like a schoolboy.
Yeah.
A good schoolboy.
That's who I am. So I actually have an interesting experience here in that it's sort of the reverse of some of that experience now, because there's 2 pediatric centers in Tucson. So we don't see many kids here. And a lot of the docs here have been practicing for a long time, so they haven't really been seeing kids for 10 or 15 years. So literally every shift I've had someone ask me like, hey, do you mind picking up the kid? And like, I'm extremely comfortable like picking up the kids because we see a ton of it at Lakeland. And that's something that I think is different than a lot of places, is that even though you don't have a specific peds ER month, I think it was Kevin was saying that you're always seeing kids every shift, like 20-30% of the patients you're seeing every day are going to be kids. So you get really comfortable with it. I mean, I had a six-week kid yesterday that like everyone else was afraid to touch, and felt fairly comfortable, as comfortable as you can with a baby that that young. But you definitely get good training in it, and I think it prepares you to work in whatever environment.
Perfect. There's some questions here. Go ahead. Anyone else want to add in?
I just wanted to add in with the trauma month that you do up at Spectrum, and Helen DeVos is part of that. It's a massive. That's where you do the PICU month. It's a beautiful, beautiful hospital. It's an amazing experience to practice up there. But the 2 months you're on trauma during residency, it's really nice because you get to work with the pediatric traumas team as well, and that really sets you up well for any sort of EDAP ER that you're going to work in, meaning the ER that can accept patients from ambulances. So it's nice to have that.
All right, cool. Yeah, so when you're in Grand Rapids, it's about an hour and 15 minutes north of us. Housing is provided. The other off-service or away rotation that we do is toxicology in Chicago, which housing is also funded. So those 3 months that you're away from St. Joseph, those are all funded by our program, so you don't have to worry about housing that month. Let's get into, I think the question that we wanted to address with everyone. And then Dr. Doherty, did you do an international rotation before I kind of go?
Yeah, I went to Sierra Leone.
All right. Well, why don't you answer that question, and then I want everyone on the panel to think about their favorite place and about St. Joe and what's the number one memory they have. So everyone think about that while Dr. Doherty answers a question about his international rotation.
So yeah, Lakeland has kind of a unique population of physicians in that there are quite a few people who have done international work, who do international medical mission kind of things. That's a little bit of a passion of mine. I've done quite a few trips. I did one while I was at Lakeland. So I went to Sierra Leone, worked at Matujong Hospital with Dr. Ron Baker, who speaks the language, and it was just a phenomenal experience. Several people have gone since I was there. Kim Stillman, one of our alum, went the year before I was there. I mean, the options really are endless. You have the options during your months, during your kind of elective months, to get out internationally and do some cool things. There's a ton of programs that you could hook yourself up with. You just have to plan ahead a little bit and make sure you can work it into your schedule. But yeah, certainly the option is there for international work.
Hey, Kevin, can you let them know about the kind of stuff that you were doing when you were there?
Yeah, man, we did everything. I mean, we were delivering babies. We were doing bush paracentesis. I mean, it's just everything. It's kind of crazy, some of the pathology that you see there that is just so undifferentiated, that shows up just way later than any stages that we'd see here in the States. And you are working with very limited resources. I could get a hemoglobin, and I could get malaria and TB. I couldn't get an AccuCheck. A blood sugar or blood chem cost the patient somewhere around $10 US, which is just impossible for these people to pay. So, I mean, we were in the OR every day with Dr. Schutnick from the Niles surgery team, doing appendectomies, doing gallbladders. We had an ovarian torsion while I was there. I mean, it's just like one thing after the next. You can't hardly work hard enough to keep up with the volume of cases that you'll see when you go to an international hospital.
Perfect. Most recently, Dr. Fazari, one of our chief residents, went to Togo with Dr. Klein. Dr. Graff also mentioned there's a connection with Malawi through Michigan State. Several residents have gone to Sierra Leone, and the experiences and what they have spoken about is just unbelievable, and the amount of work that can be done. But Lakeland itself, the premise of Southwest Medical Clinic, which is an affiliate of Lakeland, is regarding mission work. So there's tons of physicians that are traveling to mainly Africa. And actually, two of our surgeons are currently in Kenya, and they're there 9 months out of the year, and they come back for 3 months to practice here. But there's tons of international opportunities. It's just kind of melding your rotational schedule around it. So let's get into let's do the favorite things first, because then we have another long question that I'll try to piecemeal together. But why don't we start with Dr. Clark? I always love Dr. Clark's answers. Dr. Clark always would make cards for everyone. Even when she was a student that rotated here, she sent cards thanking us with the picture of the hospital on them. And I still have that card. So Dr. Clark, what was your favorite thing about Spectrum Health Lakeland and St. Joe? So why don't we talk about the program and then the area, okay?
Yeah. So sorry, my husband is cooking and it just got kind of loud. But favorite part about the hospital, I absolutely loved the program, working with the attendings and the residents. It's like a really big family at Lakeland. Everybody's watching out for everybody else. Everybody is supporting everybody, both in the hospital and out of the hospital. All of our attendings are 100% involved in the residency program. Whether they're actually GME faculty or just clinical faculty, they are 100% involved and interested in taking time to teach you, which I thought was a huge draw to Lakeland. Everybody's very enthusiastic about the residency program, including our ancillary and our supportive staff, like our nurses and our techs. They're all very supportive of the residency program. I had an opportunity to rotate there as a student and experience that, and that's kind of what drew me into Lakeland as the hospital. also the opportunity to work not only at our main hospital, but also at like the community, sorry if that's loud, the community hospital sites. Because ultimately, yes, our main hospital is community. We still have a lot of the specialists versus our other sites, which over your career in emergency medicine, yes, you might start out at the larger institutions, but at some point you're going to be working at a community hospital where it's pretty much just you, and you have to be ready to handle everything. I had one the other day with one of the residents from the main hospital was out at one of our community sites, and we had a trauma come in, and his response was, "Oh, we should activate a trauma alert." It's like, go right ahead. It's still all you. Nobody else is coming to help. So that's a really great experience, getting that at Lakeland, and there's no, I guess, competing residents. Every procedure is going to be yours. Your patients are yours from beginning to end. So you're going to learn how to manage them, whether they are a crashing septic patient or a trauma patient, respiratory issues. It's all yours. You're going to learn how to deal with all of it. Whether you have a respiratory therapist there to help you or not, you're going to learn how to set it all up and do it yourself. As far as the area, a few things that I love to do in St. Joe is I love the beach. Grand Mere.
You love the beach glass.
What was that?
You love the beach glass. That's what you love.
Yeah, I do love beach glass. Everybody knows I love beach glass. It's something that's unique to the area. And so you have to go walking along the beaches there if you get a chance to visit or have been there. You're right by the beach. I think the hospital is probably 2 miles or less to the coast of Lake Michigan. And there are parks all up and down the coast. So going out and walking on the beach, finding beach glass, definitely one of my favorite things to do. Also, there's quite a few both attendings and residents that have boats, and going out on boats is a very nice activity. One of the more relaxing things that you can do. It's almost like a vacation if you just have a few hours off.
All right, Dr. Clark, don't steal everyone. But I was going to ask Dr. Mancini, are they big boats, or are they small boats? So I'm just picking on Nick. So
killing it. Just let Katie go. Just let her go. You don't have to do more work.
We try to let you go, but you're still here. So and that's how it just gives you kind of a glimpse of how we act as attending as residents with each other, as well as the alumni. We love these guys. We're so happy that they could join us. So who wants to chime in next? I don't care who. Dr. Spiewak, not you. Dr. Graff is up.
I agree with Katie. I think it's the relationship we all have as a family. I mean, you grow as a family together. I feel like, obviously how programs are, but we've been so close for all of residency, after residency. It's great to watch everybody grow and like develop their families and get cards from everybody. It's awesome. And to hit on, I think it's Han asked a question. They're talking about the interaction and relationship between attending and residents at Lakeland. It's pretty close. It's very close. At one site, you'll have like at least two attendings on with you, and then your senior residents, and then your co-residents at times. During the day, it's all different types of shifts. And then another site, just you and another attending. And yeah, you definitely have time, especially during your intern year and PGY2. It's a lot. You don't have to just run the room. You're going to learn how to do that. Unless you're working with Mick Mancini, then he's going to make you run the room. You see red, you better go. All right. But it'll help you out in the end. I mean, it teaches you how to run a room eventually. But to answer your question, yes, the relationship's great. It's like a family, but it is a professional relationship while at work. Remember, it is a job. And I think that you have time definitely to learn and talk, sometimes talk shit too, which is always fun. You get that relationship built over PGY1 to PGY2, and then you're running that room PGY3. Attending better go take a nap while you're seeing those patients, just let them know when you're going to discharge somebody. So it's definitely good. And there's a trickle down effect too with the procedures. Since we talked about, we are able to get procedures so quickly, which was amazing. In our first year, second year, you're done with what you need to get. You can always choose to do more, but that's when your seniors can sit down and really teach the underclassmen how to do the procedures. And that's where you get your teaching experience in. So it's kind of just, it's a rollover effect. You go from learning, you already know medicine, you finished medical school, learning how to be an ER, resident and doctor, to how to be someone working in the ER, running the room and teaching ER medicine to your colleagues. It's great.
Perfect. Thanks, Dr. Graff. Anyone else? Let's go. We haven't heard from Dr. Akramovich. Why don't we finish with you on your favorite place and talk about some of your experiences with your attendings?
Yeah, I'm gonna just echo what everybody else really essentially said, especially with Katie's interpretation of what the best part about living in St. Joe is. Really, it's the beach and the unbelievable scenery that we have in the area, and the hiking and the mountain biking, and just the ability to be so close to Grand Rapids, Chicago, Kalamazoo, but still just having the ability to walk to work every day, which is what a lot of us did. And it makes a huge difference in your time frame for sure.
Dr. Graff, thank you for reminding us of the Golden Eight.
I promised tomorrow and I'd mention it. I'm sorry.
I appreciate that. All right. So let's, Dr. Spiewak, why don't you talk about, I feel bad, Dr. Longobardi, you're just hanging out. Chief resident, you're being a good chief resident.
Yeah.
It gets you out of doing, actually, Dr. Longobardi, why don't you talk to the panelists about what it means to have a family, a true family, a real family, intermixed with your residency family here in St. Joe?
Yeah. So I'm married. I have 3 kids. They're 5, 4, and 1. So they keep us plenty busy. But kind of what everybody else has said, one of the best parts about being here is the beach. And they also have this amazing splash pad down by Silver Beach that's huge. I think it's one of the biggest ones in the Midwest. And so one of our favorite things to do on my days off are go to the beach with the kids, then put them on the splash pad, let them run around. They have an indoor carousel right next to the splash pad. And then there's a pizza place right across the street. And so it's like a kid's dream to live here. I definitely feel like I'm well supported in having a family here. And when I'm working a lot, my residency family steps up and makes my wife, dinner, kids dinner, and things like that, helping out on work. So yeah, it's great to have a family here in Southwest Michigan. It's great to have a family being a part of the residency here at Spectrum Health Lakeland. Did Trigger leave us?
Trigger's taking a nap, I guess. He's got to tend to the fire, apparently, which is building behind him, apparently.
Yeah.
So,
Hey, Stevie, why don't you talk about the reunions we do every year?
I'm sorry, I'm trying to get a fire started here.
Well, start doing alumni reunions via Zoom. The only problem is I can't buy you guys booze, so that's the way that rolls. Does Grubhub have a delivery of alcohol or no?
Yeah, Postmates.
there you go.
What's
I'll download the app for you.
Go figure. Dr. Graff would know that one. So actually, the local liquor store delivers for free now.
You kids.
All right. Any more questions? Let me look through this as I scroll down. Anyone else have anything positive to say about our program, or do you just want to badger each other? I think we kind of got through all the questions that I had.
I have something.
Oh, I'm sorry. Go, Dr. Spiewak. We can never forget you. Go ahead, buddy.
Can't leave me out.
Go ahead.
One of the things that our residency has
Those
done.
things help you? Those things you hear, do they help you? Is Emily screaming at you too much?
Yes, they're very helpful, and no, she's not. She's a very, very calm, good wife. So one of the things that our residency does every year is a wilderness medicine retreat. And when I was trying to think about one of my favorite memories was actually my intern year when we had at the wilderness medicine retreat, and Dr. Akramovich was our chief that year. And it was like, you're a couple, maybe 2-3 months into intern year, and we're doing all these like wilderness training type stuff, but they're also like competitive events, and like we were searching for stuff and practicing knots and doing carries and all this other stuff. But it's really important stuff like that. But it's educational because it's not stuff that you're gonna see every day in the ER or learn about in the ER necessarily. And B, it was one of those things where you come to feel like a family. Like I feel like our entire residency was very close. Obviously, I don't have a lot for comparison because I've only done one residency, but we were very close. We spent a lot of time with each other. And I think right from the get-go, even when you're an intern and you're new and you don't know anyone else in the program, you're made to feel pretty welcome. And there's not a sense of like competitiveness or looking down on interns. I think from the time when I was an intern to being a senior resident, that there's always a feeling of the seniors watching out for the interns and trying to do whatever can get them the best possible experience. I think we all sort of wanted to hand that down to each other. When I was an intern, I felt like my seniors took good care of me and taught me a lot. And I hope that as a senior, I taught my interns and junior residents and took good care of them. And that was one of my favorite memories. There's a picture somewhere of Dr. Akramovich with a knife in his mouth and a bandana that it's pretty sweet, and I hold pretty dearly that memory.
No, I love that. From that wilderness retreat was the best when Rob Nolan was giving a lecture against an RV outside wearing a little blanket, and we're all just hanging out in the morning listening.
Yeah, so the Wilderness Medicine Retreat was July 31st this year. We've set up a fairly standardized place where we have it now, where they camp out for 30 hours. Essentially, you're given for a free time to attend the event and learn a lot of wilderness medicine splints, as well as I don't want to say seek and destroy. That's not what I'm looking for. Seek and find in other types of toxicology, like we did envenomations this year, envenomation dartboard this year. So lots of activities. They have a upcoming resident retreat with the other programs at one of the new kind of obstacle courses in the area that will be taking place on September 25th. So any other questions? All right, we got one here. Oh, got a couple. Sorry. Dr. McCarthy's failing me.
It just came in.
We're going to finish up around 8 o'clock, guys, so we won't keep you much longer because you guys are very busy. I know Dr. Graff has many things to do this evening. No, staying in tonight? All right.
I'm off till Thursday.
Oh, you suck. I got to finish my lecture for tomorrow, so.
See, this is why I don't work at a teaching hospital anymore.
Well, but I educated all of you, and you seem to do okay. I think we're in a good place. Let's see, Dr.
Cost of living.
Oh, cost of living. Who wants to speak of cost of living?
Too much.
It's I lived on the lake for $650 a month.
That house just sold for $750K, and they're putting another one into it. So you were very lucky. So if someone else could actually talk about the cost of living in St. Joe,
I bought a house when I moved there, which was, I think, one of the benefits of that area is that you can't afford to buy a house. The market has gotten a little bit crazy everywhere because of COVID, and the area of the market's pretty hot. But you can buy like a 3-bedroom, 2-bathroom, 2-car garage kind of house for mid, 150s or somewhere about there. And your mortgage would be, I was paying like $1,200 in Chicago for rent, and my mortgage was like $800, and I had a backyard, and the restaurants there is like hard to adjust to living in a different place now, where like you could go out for beers or dinner or whatever, and drinks are like $6, $8, $10 for a meal, and now like a drink is $12 here, and it's just different. The cost of living is probably one of the best in the country. I can't imagine a place being much cheaper than St. Joe to live in and go out to eat and drink and that kind of stuff. So it's a nice place to live. And there's also apartments that were built after the start of my intern year, so it wasn't really an option. And those apartments are like right on the lake, beautiful area, beautiful view of the lake. And they're super affordable. Like for that kind of, I don't know exactly how much they are, $700-800 a month for rent. In Chicago, you'd be paying double or triple that. So the cost of living is great. It's a nice place to live. I saw one of the questions was about moonlighting. You do have lots of moonlighting opportunity. There's a freestanding ER that's part of the system that you can moonlight at and feel like you're not too far away from your attendings and that kind of stuff. And there's some other opportunities in the area as well.
Yes. So our moonlighting policy will change a little bit, transition to a program, but basically you have to be in good standing. You have to achieve a certain level on the in-service exam and then be approved by the core faculty. Regarding, I'm trying to think of what's the name of the new apartments. Lookout Point. So Lookout Point has 1 bedroom, 2 bedroom, and 3 bedroom apartments right on the lake. The highest cost I want to say is $1,200 for a 3 bedroom apartment, which is really inexpensive. A 1 bedroom I think goes for like $600, which is really nice, and you get a discount through Lakeland as Lakeland owns it. $650. There you go. Dr. Mancini knows.
And they're really nice. I mean, they're like granite, stainless steel, nice apartments.
Yeah, they have a gym and like a common area and fire pits outside, and it's right across the street from the lake too.
All right, one more question I think I saw. How are presentations performed? I guess, is an attending involved in every case, or is it, do the juniors present to seniors? I don't care who wants to respond. For all the alumni, it really hasn't changed. It's always 2 attendings on for the most part. So go ahead and talk about how you present the attendings.
Like this, you just stay quiet and let them figure it out. No,
Bueller. Yeah.
it's your intern year. It's at the beginning, like anything else, it's going to be a new work environment for you. Everything's going to be new. So you'll likely be seeing the patient for a little bit, alongside the attending. And every attending does it a little differently. Some see them with you, such as Heisel would always usually walk in the rooms with us with this high-pitched voice. And then most of them, though, you'll go see the attending, make sure you know some of the past medical history, the vital signs, and then you're doing an ER presentation. It's pertinent. You're presenting pertinent things to the attending. Usually not presenting to the senior resident unless it's something you think would be critical and you can't find the attending. You just want to chat about what you're going to do next. But yeah, it's going to be you seeing the patient, figuring out your plan, pertinent things about the patient, and presenting your plan going forward about the patient to your attending you're working with. But they're there with you all the time. I mean, I've never had a situation at Lakeland where the attending wasn't there when I needed them for anything ever. So,
Hey, Katie, can you chime in and let them know how it changes from year 1 to senior year, how those presentations kind of change?
Did you say Katie? Yeah, sorry, my dog just came inside.
You got it.
Dr. Clark.
Yeah,
sorry,
so that's okay. No, so your presentations, they get shorter and shorter as your years go on. So as an intern, you're giving kind of more of a full presentation to your attending. The other thing that I did want to mention is you're always at least 1-to-1. So you're going to have an attending that's sitting right there that is ready to listen to you, that is ready to teach you, that is ready to see the patient the moment that you tell them about the patient if you are concerned about them and want them to be seen. Because the point of the attendings is to be there to teach you. It's not a hospital system that they have loaded up with residents because they need the residents for it to function. They are focused on teaching and providing a great teaching environment. But as you move up, once you're a senior, you are doing more very short presentations, and they'll ask you if they need to know more information. You might see a few patients before you're presenting. As long as those patients are stable, you're comfortable, you've worked with your attendings, you'll get to know your attendings as time goes on. But it's really great that you have the 1-to-1 because not all programs offer that.
That's right. So Dr. Longobardi, as you're still here present, and I'm sure all the other alumni will be able to agree with you, how do the attendings proceed within a code or a level 1 trauma? What is the attendings role, and how do they interact with the residents during that?
So I think it depends on your level of training. So for me at this point, most of the time the attending is kind of standing in the corner of the room and doesn't say much at this point and just kind of lets me run the room, own the room, and delegate as I need to. In fact, the other day when I was in a trauma, Dr. Nolan was doing my FAST exam for me as we were going along, just because I needed an extra hand. So they're there to help. They're there to answer questions. But certainly at the senior level, it's your room, and they're just kind of there monitoring things. They may be a little bit more involved earlier on in training, and maybe there to direct you. But they definitely want you to feel like that it's still your room even early on. So yeah, I think definitely it puts you in a good position to have the confidence that once you get done, to be able to know that you can handle whatever comes through the door.
Yeah, you're never alone, but you're always being pushed more. So it's a nice place to be.
Yeah, I mean, we speak of red on the board in regards to new patients. I mean, you see red, our residents are on it. There's very few times that a patient waits more than 20 minutes to be seen, and 20 minutes is probably a long time before a patient's seen. So Dr. McCarthy and I were, we were just talking, and we pretty much stand in the corner and let the residents run the room, especially in traumas. It's hugely important that your hands are in it. And get actively involved. And we try now, especially transitioning to a 3-year program, we involve our interns very early. Pretty much day one, I think one of our interns intubated a patient, did a procedural sedation, as well as reduced an ankle fracture. So it's hugely important that we involve, and it's kind of all hands on deck kind of idea here. So can I go through any further questions? Hey, Dr. Mancini, how many electives are there available in a 3-year program?
Hey, so that's changed. The residents used to have 4 elective blocks, but now it's down to 2 elective blocks. And that's just given the 3-year format that allows for little variability as it relates to electives, and also the amount of ER time that you have to spend. So that definitely is shortened. I do see another question here related to other international rotation opportunities in different places, like I think Jordan and a couple other locations. The beauty about the Southwestern Medical Clinic as it relates to international rotations is they have relationships all over the world. So the reason why we specifically look at places like Togo, Haiti, Sierra Leone, and Madagascar, those tends to be the hubs of some of these locations. But very much there's opportunity anywhere internationally for these rotations, just because they have previous experience and opportunities with these other countries.
And regarding ICU months, we do 1 intern year, 2 the 2nd year, 1 the 3rd year, and there's also a PICU month. Our 2nd year is really heavy on critical care, which is hugely important. We're down to 1 trauma month. You do a trauma month as an intern, and then no longer you do trauma. We will post, there you go, Dr. McCarthy just posted. Does anyone have any other questions as we wrap up? I don't want to keep our alumni because they're all very super busy, as you can tell, as are the attendings. Chief resident, you don't count. You're always on the clock, buddy. But does anyone have any further questions before we kind of wrap up? And does anyone have any final thoughts to close on before they say goodbye? And we'll see you guys soon again. Thank you all for joining. So any closing remarks or further questions? The one thing I will talk about, I'm sorry. Oh, there's Dr. McCarthy.
Yeah.
It's in my shower. Look at my outdoor shower.
No, I'm not. I just had a lot of computer stuff to do, so you wouldn't want to just stare at me like this the whole time.
Yeah. The closing remark for anybody looking at the new residencies, we've spoken highly of Lakeland. We all obviously chose it. Choose somewhere, you'll get a gut instinct. Choose somewhere where you know is a good fit for you. You'll feel it right away when you're interviewing. All of us, it was a great fit for us at Lakeland, and it's an amazing residency. You're going to be pushed really hard, and choose a residency you're going to be pushed hard, but have that support of a family in a residency, which we had. I think that's the most important thing. You'll come out happier and a better physician in person.
See how they interact. See how the residents and medical students and attendings interact with each other, because that's going to be a huge understanding of how that residency is going to be long term. Because at a place like Lakeland, there's there's a lot of collegiality there. And, some places that you go, you're not going to find that.
And I would add to what Eric said, and go to a place that the program director is going to have your back and the faculty are going to have your back. Residency gets hard sometimes and life gets in the way sometimes, and there's going to be bumps in the road, and you want to set of people who are going to help you through that and not to discard you to the wayside and kind of trample you along the way.
I think also when you're sort of looking at residencies, it's easy to get swept up in like level 1, the name of the residency, that you're going to Brown EM or UCSF or Cook County, those kinds of names that sound really fancy and they look good on a resume. But I think like kind of what the other alumni were saying, that if the spot fits you and you fit in, you'll make the most of any residency. But I think that Lakeland really helps draw the best of you out of yourself to help you become the best doc possible. I really think that the residency pushed me in a really good way to be really a good doc. And I think it's excellent training. I couldn't imagine having gone anywhere else.
Well, that was heartfelt, Dr. Spiewak. So thank you so much. I appreciate all you guys joining us. We're going to kind of end tonight because we've already absorbed 60 minutes of your time.
Thanks,
so thank
everybody.
you so much.
Good to see you all.
Yeah, thanks. Appreciate it. Please shoot a question. Follow us on social media. We'll keep posting, and Dr. Mancini will keep yelling at us. Thanks, guys.
Good to see
Thanks for
everybody.
having us.
Yeah.
Bye, guys.
Everybody.
Love you guys. Bye.
We'll see you next.
Bye.
Mancini.
Go, Joe.
Bye, everybody.